Well, it's no secret the pandemic has negatively impacted Americans' mental health. Cases of anxiety and depression have skyrocketed and fatal overdoses have hit record levels. But Mitch Legan reports that 2 years into the pandemic, that alcohol consumption is still up, and recovery experts are concerned about the potential impacts.
The beginning of the coronavirus pandemic was a stressful time for Americans. With people stuck at home and unsure of the future, many turned to alcohol to cope. Studies reported a 50% spike in drinking initially, with levels remaining elevated throughout 2020. But addiction experts say it's still an issue that could have serious consequences down the road.
Folks presenting or at least getting referred to our services, it began to increase and has been increasing to this day.
Spencer Metcalf oversees peer recovery services for emergency rooms across the IU health system. When someone arrives at an ER with substance-related issues, he connects them with recovery resources and pathways to treatment. The number of patients he sees with alcohol issues has soared since the pandemic, increasing 65% from 2019. Last month's numbers were the highest for a February since the program started.
Prior to COVID, what we were seeing were folks that maybe were drinking, 5 to 6 beers, or maybe kind of at that level where they didn't really need inpatient detox or things of that nature. And now I would say most patients that we're seeing related to alcohol are almost slam dunk cases for inpatient detox.
Metcalf says the people he's helping fall into two main groups: those whose recovery was interrupted by COVID and those who began drinking more because of it.
Regular with the creamer, right? Okay.
For Matt Cochran, the pandemic pushed him back to the bottle. He was recovering from alcoholism in March of 2020, but had trouble dealing with the stress that came with the pandemic.
At the beginning of the pandemic, it was more of a relief, a stress relief in the evenings when I get home. It got to the point then where I was a lot more dependent on it.
It got to the point where Cochran was drinking throughout the day, so he checked himself into treatment at Community Fairbanks Recovery Center in Indianapolis. He's been sober for 7 months now and volunteers at the coffee shop there to give back.
The scariest place for an alcoholic to be is isolating and not around anybody else. And we're at home and there's nothing else, to really do, so we drink.
As for those who started drinking more because of the pandemic, studies have shown women were impacted most. For many, it was a way to cope with the stresses of work or childcare. And for some, it still hasn't let up.
If you come home and your husband or wife is doing cocaine all of a sudden, that's a huge issue and a red flag, etc. Seeing your wife with a glass of wine on a Tuesday is just not that big of a deal. Maybe long day, I'm having a glass of wine, and so it doesn't register in the same way.
George says it'll take some time to feel the full scope of Hoosiers' increased drinking. Much of the pandemic data isn't yet available, but last year's tax revenues from alcoholic beverage sales were up $6.5 million from pre-pandemic levels. As more people return to work, many are reconsidering their drinking habits over the past couple of years.
Maybe somebody that used to start drinking at 5 or 6 o'clock starts drinking at 2 or 3 o'clock, or maybe somebody that used to have an afternoon drinks now having the morning drink. But without the accountability there's been no, consequence or no awareness about it.
The impacts could mean more medical issues for heavy drinkers, or it could impact their jobs and family life if it hasn't already.
There's not the same red flags you would have with other drug use that immediately show, hey, we should take a look at this because alcohol is so accepted. And there's often just such a delay.
George says he's been in contact with people at the State House who are actively monitoring the situation. The hope is, with things opening back up, more community-centered recovery treatment will be available, and Hoosiers who have an issue will be able to get the help they need. For Indiana News Desk, I'm Mitch Legan.
Anyone having trouble with alcohol or other substances can call the state's addiction hotline.